Is there any family history of breast, ovary, or colon cancer? Now, I asked these three specifically because they are known to be hereditary in some cases, not in all cases, but in some cases they're known to be hereditary. And so I asked that because I want to know, should I be testing this lady sooner? Good morning. This is Dr. Durowade from Dardur Gynecology. I hope you've been well. I wanted to drop a quick video this morning because it's September is Ovarian Cancer Awareness Month. When patients come to my office for their annuals, I ask the routine questions, medical history, surgical history, medications. But there's one part of the history that I always ask. And I say, is there any family history of breast, ovary, or colon cancer? Now, I asked these three specifically because they are known to be hereditary in some cases, not in all cases, but in some cases they're known to be hereditary. And so I asked that because I want to know, should I be testing this lady sooner? Should I be screening her with a mammogram sooner than the recommended age of 40? Should I be screening her with a colonoscopy or referral for a colonoscopy before the recommended age of 45? And should I be sending her for genetic testing? We don't have a screening test for ovarian cancer. There hasn't been anything proven to actually detect it early and prevent people from dying from it. So we don't have like a mammogram or an ultrasound, or we can't do a CT scan on everybody. And even an ultrasound may not show signs of ovarian cancer until there is like severe symptoms. And severe symptoms meaning like severe bloating, weight loss, fluid retention. By then it's stage 4, right? So, the only tool we have for ovarian cancer is knowing your family history and getting genetic testing. If anyone in the family has had ovary cancer, anyone at all, you should get genetic testing. You want to know, do you have an increased risk of ovarian cancer? Or if there are multiple family members with breast cancer, then you want to check, is there a BRCA gene, or what we call BRCA gene? There is actually a BRCA gene that has a higher risk of ovary cancer versus breast cancer. So these questions are important because annual preventative exam is to prevent things that we can prevent. The people that have been diagnosed with ovarian cancer early are people who were having surgery for something else. And then they saw that their ovaries looked abnormal. They took it out and it was stage 1. Most people are not having routine surgery that is going to give opportunity to see their ovaries. So it is important to know your family history. My patients will come to me and say, my family, they don't really want to talk about this. People, the older generation don't really talk about this. If you have access, I recommend asking, what runs in the family? What do I need to know? And then tell your doctor and say, okay, how do you test for this to make sure it doesn't happen in the rest of the family? It's important. So if you know someone related to someone with ovary cancer, see if you can get genetic testing. Ideally, oncologists nowadays are recommending or doing routinely or recommending genetic testing to their patients who have ovary cancer. And if there's a positive gene, then they test everybody in the family for that. But let's say that person was diagnosed so late, they passed away, you can still be referred for genetic counseling. Genetic counseling will then determine if you need genetic testing. It's important. And so I just wanted to drop that quick note this morning so that we can be better prepared. All right. Have a good day.